Hi, my name is Matthew Links. I'm a medical oncologist from Alice Springs Hospital, and welcome to this video in our series 5 Minutes of Remote Cancer Care. This video is on targeted therapy with tyrosine kinase inhibitors that act on multiple pathways. It's aimed at health workers in remote communities caring for patients on one of these drugs. I'd like to start by acknowledging the Aranda people on whose lands I live and work, and elders past, present and emerging from this community and from all of the remote areas that receive care with us. The goal is to focus on practical issues, both in the acute setting with symptomatic presentations and with ongoing care. Now, there are multiple types of targeted therapy. This talk is confined to drugs that act as inhibitors of multiple pathways. Multi-receptor tyrosine kinase inhibitors share common features and include drugs like pazopanib, lenvatinib, sunitinib and everolimus, and they're used for a variety of cancer types. Some of the toxicities reflect individual pathways like epidermal growth factor in the skin and gut, or vascular endothelial growth factor in the blood vessels. And some are more general, like fatigue, liver function tests, abnormalities and QT prolongation. They can be very well tolerated, but it's often the cumulative effect of multiple issues that forces dose reduction, and we often have to interrupt treatment for cumulative toxicities. A key task is to communicate in simple language what targeted therapy is. We like the metaphor of cancer being like a weed, for example, bufflegrass, that takes over country. Targeted therapies are medications that are like weed killers that pick out the weeds and mostly leave the other plants alone. But sometimes other plants get hurt by mistake, and this is what causes side effects. Common toxicities focus on the clinic are listed here, and you'll note that they differ from the usual sorts of things we worry about with chemotherapy. They're generally low on chemotherapy type side effects like nausea, myelosuppression or alopecia, and are very often well tolerated if the dose is right. Common issues depend on the pathway targeted and can be vascular, like hypertension, proteinuria, skin with various types of rash, diarrhea and fatigue, and these are all treated in standard fashion. Important to note are the possibility of drug action interactions and QT prolongation, as well as monitoring adherence in clinic. There's some left field toxicities to be particularly aware of, including thrombosis and impaired wound healing. The important question is safe handling of hazardous drugs, and although these drugs are not cytotoxic, you still don't want your children or your dog taking them. So it's worth checking the need for temperature control, and standard advice about toilets and sexual exposure apply. If there are problems with drug safety, then consideration should be given to supervised therapy of some form if possible. Now, as with all cancer patients, a major role of primary care is providing ongoing support and identifying any unmet physical, psychosocial and cultural needs. This is an invaluable feedback mechanism. Identifying these needs, mobilising the support available in primary care and communicating information about unmet needs back to the oncology service is really helpful. There's a lot of additional information available, and particularly useful is the Evercue website. You can search for the drug name and get patient information and clinical information on individual drugs. There are also guides on safe handling, side effect and toxicity management, and a guide for Aboriginal health workers. I've also enclosed some other papers of interest. Thank you to all that have reviewed this video. We would love it if you could leave feedback either by email or by leaving a comment on the YouTube channel. Thank you for your care of these patients. The care is complex, and in order to do it well, we really need to work effectively as a team to share the care. Thank you and good luck.